A local organization is working to improve the lives of people over 1,000 miles away. The Saint Rock Haiti Foundation is based in Milton. The group works to improve health care, education, and infrastructure in Saint Rock, Haiti. The foundation has improved the lives of more than 100,000 registered patients. And joining me now is Jocelyn Bresnahan, President and CEO of the Saint Rock Haiti Foundation. Thank you so much for being with us.
Thank you so much for having me.
Absolutely. We want to talk overall about what the Saint Rock Haiti Foundation is all about. What is the mission of this organization?
Well, the mission, first of all, is we are a mission-driven organization and community-led, and that's really important to us. And our goal is to help walk alongside the people in rural Haiti so that they have access to health care, health equity, education, and sort of a bridge to education to economic opportunity and sustainable livelihoods.
Yeah, absolutely. Why was Saint Rock chosen when you were picking a place in Haiti to do this work?
So that goes back many years, more than 25 years ago now, when the founder of the foundation happened upon this rural section of Haiti and fell in love with it and got to know the people. And it was really the people themselves that identified what their need was, and it was healthcare. The area was completely absent of any healthcare, although we are close to Port-au-Prince in the commune of Carrefour. We are up in the rural mountains, and so that is where sort of stakes were laid. Yeah. And we have been there consistently within those communities that touch about 450,000 lives. And what we have seen is really helping to provide tools for the people that are there. We help to increase their capacity, and they are the ones who are leading their communities in all of those areas that all intersect.
Yeah. You said something that was really important, that you walk alongside the community
Right.
folks that are there. That's important. Talk about what you mean by that and the resources that you provide there.
Great. So yes, we feel that it is not our job to go in and to do, but to truly accompany the people that are living in the communities, yeah, because those are their communities. And we find that if we can help identify capacity within the people in the community, they will flourish, they will rise, and it's wonderful for us to just be there to help sort of recognize the assets that they have and supply some of the tools that they need to really to lead their own lives, yeah, in really meaningful and rich ways. And in Haiti today, that is a really complex complex situation.
Wanted to talk to you about that as well, because it is a challenging time in Haiti right now.
Yes.
How are you able to go in, do the work that you're doing, and I know the need is greater, yeah, than ever. Talk about how you're navigating all of that with the volunteers and the work that you're doing.
So the model that we used to follow in regards to helping to build capacity and to work alongside our partners in Haiti was literally that. We would go in, we had volunteer groups there almost every month, every other month. A lot of them were medical volunteers from some of the local Boston hospitals. And that created, I think, a lot of trust in the community, yeah, and people got to know us. And we've never left that community. It's been 24 years. And so I think that that has really been the key of going in, walking alongside when there is a need. And it helps to build that idea of sustainability. We've never been just a relief type of organization. Of course, over the course of 25 years, there have been situations in Haiti where we have had to provide that sort of more intense direct relief. Right, after the 2010 earthquake, we were there working after hurricanes, other natural disasters. There is an element of relief needed, but it's mostly about sustainability and helping the community to build that sustainability. And there's just a lot of trust
I love that. And that takes time, right, to develop.
It takes time.
Right.
It takes time. We talk about that with other younger organizations, and nothing happens quickly, and you have to have a lot of patience, and especially in Haiti. And again, our model has changed. We're not able to be there. We're not able to, our U.S. volunteers, I've not been able to be there in 5 years, where I was very used to being there on a regular basis. But this model of building sustainability in our staff has proven to work the way that we hoped it worked. They are there, 200 strong, running all of our programs. They're in charge.
Yeah. I wanted to talk about the primary care and the health care that is, being helped and being carried through when you go to Saint Rock. I mean, Haiti, we know, has a high maternal and infant mortality rates, but especially rural Haiti.
Right.
How does your organization address that? And for mothers, expectant mothers, babies?
It's a great question. We have an initiative right now that is focusing on maternal child health care. We are a primary health care service provider, so we care for men and women and children and infant, but we know that there is such a high risk of maternal and child poor outcomes that it is a particularly important focus for us. And so what we are doing is trying to expand those programs. What we currently offer is prenatal and postnatal care. We follow infants through the first year of their life. We make sure they have all their vaccinations, but there's this really critical gap in the middle, and that is when a woman is to deliver her baby, and that is where so much of that high level of maternal and infant mortality occurs. So what we are doing is we have 2 maternal waiting homes.
Excellent, excellent. Jocelyn Bresnahan, we appreciate all the work that you're doing over there, the Saint Rock Haiti Foundation. For folks who are interested in being a part, we're going to put details on our website, WCVB.com. Thank you again.
Great. Thank you so much.
Thank you. Thank you so much for watching. CityLine is about the stories that shape our communities. We want to hear yours. Share what's happening where you live at CityLine at WCVB.com. Be sure to follow us on Facebook and Instagram, and have a wonderful afternoon.